And this is what he called true acupuncture. And this was where you have those remarkable effects, those instant results, and those long lasting transformations that can occur.
Welcome, everyone. My name is Zachary Lui. I'm a board director at the Professional Association of Traditional Chinese Medicine, Ontario. Our aim is to achieve widespread acceptance and understanding of the scope of practice of registered acupuncturists and registered traditional Chinese medicine practitioners, as well as support professional growth of traditional Chinese medicine in Ontario. Equipment and software provided by Wuji Xuan Life Wellness, proudly supporting the growth and professional standards of acupuncturists and traditional Chinese medicine practitioners. So today we have Christian Saint-Pierre, and he is registered with both Acupuncture and Traditional Chinese Medicine Association of Nova Scotia and the College of Traditional Chinese Medicine Practitioners and Acupuncturists of Ontario, inactive. He holds the highest level of certification in the Balance Method and Advanced System of Acupuncture from Taiwan, renowned for instant pain relief. Christian is also a certified Bazi and I Ching practitioner. So, Christian, thank you for joining us on this episode today. What got you started in TCM?
Thanks for having me, Zach. I think, like a lot of male practitioners, I sort of gravitated towards Chinese medicine through martial arts. And there's a sort of a long version of why I entered into Chinese medicine, which involves sort of a pursuit of a sort of philosophy. But there's also a simpler version, and that happens to be my grandmother. My grandmother was a World War II nurse, and at some point in the 90s, she developed a condition, a biomedical condition known as Meniere's disease. It's a balance condition. It involves, not having good balance, walking, swaying unsteadily, feeling dizzy, having vertigo. And she would walk down the sidewalk and young men would stop her and say, "Granny, you shouldn't drink so much." But she hadn't had a drop. So, of course, she went and saw her family physician. And he said, "I'm sorry, but there's not much we can do for you." Well, being a World War II nurse, she did not agree with that. And so she started looking for alternatives. Happened to come across an acupuncturist, a local acupuncturist in Sudbury, Ontario. And, she had, I think it was 12 treatments. And she was able to overcome the Meniere symptoms and walk a straight line, and the symptoms never returned.
Wow.
So I thought that was pretty cool. Now, when I was younger in the 90s, I used to suffer from severe cluster headaches. And cluster headaches are like an ice pick headache, okay? A drilling headache. And it was so bad that the pain would make me vomit. So when I saw her having such good results, I decided, why not give it a try? And I had a course of treatment. It was about 8 to 10 treatments. Haven't had a cluster headache since. So I said, wow, this is really cool stuff. What's going on? And so I sort of started studying independently, eventually found a school in Nelson, British Columbia, and the rest is history.
Wow, that's quite a story, especially because you, like first your grandmother and then yourself, had actually seen results with acupuncture. So when you were schooling, there's lots of different theories around traditional Chinese medicine. Is there one that you kind of gravitated toward to try and replicate those type of results?
So, yeah, I follow something called the Balance Method, which is, for all intents and purposes, I guess you could call it Taiwanese acupuncture these days. But another way of looking at it is that it is a type of authentic or classical acupuncture, or even Taoist acupuncture. There are many different sort of schools of thought in acupuncture. The two large ones, I think, would be what we call a Taoist approach or a Confucian approach. And what ended up happening is that the Confucian approach was the official sort of, let's say, the national medicine in China for many, many years, centuries. And the Taoist medicine was sort of pushed aside in favor of the Confucian medicine for many reasons. What ended up happening is that through various revolutions and various conflicts, a lot of Taoist practitioners ended up moving to Taiwan. And then that happened, of course, again in the 40s, right, with the rise of Maoism. And a lot of scholars, a lot of practitioners who were practicing the old ways were forced to flee, and many of them fled to Taiwan. So Taiwan sort of became a hotbed of sort of the original way that acupuncture was practiced. It followed the original theories. What we often consider to be traditional Chinese medicine today, while very effective, I have no qualms about it. It is very heavily leaning towards herbology. So herbology is a wonderful modality, and it's indispensable for health. However, within TCM, acupuncture has in some ways been treated like a prescription or treated like an herb. Whereas in classical acupuncture theory, it is something completely on its own. It has its own methods of diagnosis, it has its own methods of point selection. And there is a wonderful account of the older approach to acupuncture, which is actually contained in the writings of a French doctor. He was a practitioner in the late 1800s. He was one of the first Europeans to be recognized as an acupuncturist by Chinese practitioners. His name was Georges Soulier de Morin, and he wrote this huge volume. Within that, he actually talks about sort of the different types of acupuncture, and he starts off with the simplest kind, which he calls primitive acupuncture. Primitive acupuncture is practiced around the world. It has been practiced around the world. It's essentially local acupuncture, right? If you have pain in your elbow, well, you treat the elbow. You stick a needle in the elbow, and guess what? You'll probably have some relief. However, the results are not necessarily complete. They're not long lasting. There are risks involved in terms of aggravating the area even more and these kinds of things. So local acupuncture, yes, definitely a type of acupuncture, but the most primitive kind. And then he talked about meridian acupuncture, which is a little bit more elegant in the sense of we have these theoretical channels of communication between different parts of the body. And if you have pain on a particular channel, then you can regulate that pain by needling that channel, but at another point. So a classic example is someone who has a one-sided temporal headache. That's on a channel which we often call the gallbladder channel. And the gallbladder channel runs from the head down the side of the body, all the way down the side of the leg. And there are actually points which you can use near the foot, below the knee, or even up to the knee, which can have actually really good results in relieving that headache. It's on the same channel. And so he saw this as sort of a step up, another level of elegance or of refinement of acupuncture. And then he finally says that we have something called true acupuncture. And true acupuncture takes the Taoist philosophies of yin yang, especially. And the idea is always that of balance. So when you have a problem on the left, you want to treat the right. When you have a problem in the upper part of the body, you want to treat the lower part. If it's in the front, you want to treat the back. Or if it's in the back, you want to treat the front. If it's on yin meridians, you want to treat yang meridians, right? If it's inside the body, you want to treat outside the body. And this is what he called true acupuncture. And this was where you have those remarkable effects, those instant results, and those long-lasting transformations that can occur. And I remember reading that and going, yes, this is what I want to do. How do I do it? He didn't explain how to do it. And so since my graduation, my pursuit has been the pursuit of true acupuncture. And I finally found it in the balance method.
Right, right. And then thanks for describing that for the general audience, because I know a lot of times, even for myself, I mean, I utilize the system myself in practice through my teachers, and you'll do things on the phone. People are like, why does this work for my head? Why does this? Shouldn't you be needling directly to the back? Because that is a stereotype in some ways, that some people like local needling, direct action points. And I think there's a time and place for that. However, if you don't do that, then you have to explain the rationale behind it. So could you explain just a little bit about that for our audience?
Sure. So obviously, we have two paradigms which we live with here in North America and in Canada, especially. We live with the biomedical paradigm, right? Everybody grew up in Western society. Everybody goes to see their family doctor, and Western medicine, right, for all of its right hiccups and problems, is very effective. I mean, there's no two ways about that. And to its credit, and this is something that I really like about biomedicine, is that it is always evolving. And we see time and time again how biomedicine discovers something. And as Chinese medicine practitioners, we kind of go, oh, yeah, we knew that, right? It's already something that has been accounted for through empirical experience or through a systems theory, which we actually use and employ. So, of course, there's been a lot of research and a lot of interest in how acupuncture works. And a lot of people don't realize how long acupuncture has actually been studied in the West. Acupuncture was introduced to Europe in the 17th century. That's the 1600s. And this was the time of logical rationalism, where Britain, especially with its colonial sort of, aspirations, was running around the world and applying its worldview willy-nilly all around. And this actually ended up doing a lot of harm to a lot of different cultures, because logical rationalism, a big part of logical rationalism is, of course, the scientific method. No problems with that. However, they were very quick to assign the label of placebo to various different medical practices around the world. And when they came to China and they heard about acupuncture, they assumed that this would just be yet another domino to topple, another placebo effect. Now, I don't know the exact practitioner, unfortunately. I'd love to have this information. And if anybody has this out, please send it to me. But there is an account of doctors and scientists being in China investigating acupuncture. And there was a Chinese acupuncturist who he seemed to know what they were looking for. He seemed to know what they were up to. And so he invited them all to a medical theater, and he brought in a dog, and he did acupuncture on the dog and then performed surgery on the dog without any other anesthetic other than acupuncture. And the dog lay still, was fine. He stitched it up, took the needles out, dog walked away, was totally fine. And the doctors and scientists who were there, they said, animals don't have placebo. Right. So that was the start of research into acupuncture. And it's been a long time. The people have researched this for hundreds of years. Initially, they thought that they were looking for the one mechanism, right? What is going on? When you stick a needle in, what is the mechanism? What are meridians? What are this? What are that? And they were looking for the one thing that acupuncture was doing. I'd say over the last 40 years or so, things have evolved. And now medical researchers realized that acupuncture acts on a host of systems. And as an acupuncture practitioner, we recruit or take advantage of one or two or three of those effects as needed. So for pain, I think that the most common, I guess the most well-researched and well-understood concept at the moment is something which we call gate theory. So pain signals run along small nerve fibers, right? Whether it's caused by inflammation or trauma or dysfunction or whatever, pain runs along these small nerve fibers into the brain, but to get to the brain, it has to pass through a structure which is the equivalent of a door or a gate. And that gate is generally open. However, what researchers found is that when a large nerve fiber is stimulated, like a motor nerve or something like that, when it's stimulated in a particular way or strongly enough, then that pain gate closes. And so the pain signal is blocked. Okay. So when you stick a needle into an acupuncture point or into a meridian and you obtain a strong stimulation, what's happening is that you are essentially stimulating those larger nerve fibers, and you're actually closing the pain gate. Okay.
Right.
Now, what's fascinating is that Chinese medicine has, over time, sort of determined that it's not necessarily the nerve fiber that's closest to the pain that's going to be most effective at shutting off that pain. So think of the gate as being thousands or hundreds of thousands of gates. And the different large nerve fibers throughout the body are really good at shutting some of those gates. So for instance, if you have elbow pain, then stimulating a nerve close to the knee would actually be more effective at closing the pain gate for the elbow than something than a point which might be close to the elbow or on the wrist or in the head or something like that. So that's sort of the biomedical explanation. And as far as the TCM or the acupuncture explanation, as I mentioned, it's about balance. We use yang meridians to treat yin meridians. We use the left to treat the right. We use the top to treat the bottom. And this fundamental principle evolved almost as an intuitive understanding as to what was going on in terms of this gate theory that I just talked about.
Right. So you've talked about the acupuncture pieces. What are common problems you're generally seeing in clinic? Because there's just so many. However, you probably have a certain group that you like working with.
Well, I consider myself a general practitioner, so I don't really have a specialty per se. I'm really good with back pain. I mean, that's something that I will say. Headaches as well. The headaches were an interest of mine because I used to have headaches and issues with, interestingly enough, issues surrounding the emotions as well. So I find that emotional acupuncture has a strong benefit on helping people's mental health. And again, there are reasons for that. But as a general practitioner, I make myself available to anyone who has any kind of pain, of course, and anyone who wants to give acupuncture a try to either reduce their pharmaceutical load if they have a chronic internal condition, whether it's insomnia or whether it's a heart condition or a stomach condition or high blood pressure or anything like that. Acupuncture can very often, pardon me, it can actually help reduce the pharmaceutical load. Sometimes people can even completely stop taking their medications because we are working at sort of recalibrating the system in such a way that it can run in a balanced and healthy way on its own. Now, that said, I do a lot with my patients involving lifestyle changes as well. I mean,
Right.
we shouldn't expect someone to live a very unhealthy lifestyle or have a very unhealthy mindset and get one or two treatments of acupuncture and think, yeah, okay, that's it. I'm healed, right? As long as the aggravating factors are still present, then of course the condition is at risk of coming back.
Right. So you mentioned that you do work with emotions for that. So for the audience, they may not know what that means. Is that stress? Is that sadness and grief? I know within Chinese medicine, we work with the whole spectrum. However, what does that breakdown look like for you on an everyday level working with your clients?
So there are a bunch of different things. So stress, of course, is something which we can all relate to. And we have, I guess we would have two types. We have acute stress and we have chronic stress, or we have acute emotional upset and chronic emotional upset. Acute emotional upset, acupuncture of any type is great for acute emotional upset. And one of the reasons for that is that acupuncture can take us out of when we're acutely upset, then we are very often in what we would call a sympathetic state or a fight or flight state, right? The stress state. And all it takes is a single needle, and the effect of that needle, the general, or we would call the non-specific effect of any needle stuck anywhere in the body, is that it is going to sort of downregulate the nervous system. It's going to prompt the nervous system to go from this really agitated state into what we call a parasympathetic state, which is people often call it the rest and digest state. But
Right.
it really is the rest and regenerate state. It's where we rest and we recover. And in order to do that, of course, when we are in that state, our mental state is much calmer. So that's at the acute level, and that's really easy. And of course, I often have people come in and, I've just had such a crazy day, or I just learned that my dog has to be put down, or strong emotions, but they're generally momentary or very acute. And so we can help people calm down and really moderate. And this is really important because from a Chinese medicine perspective, all serious illness comes from the shun, or what we call the heart mind, which is our thoughts and our emotions, or in another way, sort of our stress levels. And so if we can nip stress in the bud, okay, we have this acute problem and we can really calm down and help the body to process the situation in a much calmer way, then we are avoiding long-term problems down the line. So when people say, acupuncture is good for stress, yes, it absolutely is. And that is not an insignificant thing at all. When it comes to chronic problems, such as mental health issues or PTSD, or people who have sort of a really they easily get frustrated, or they're very fearful, or these kinds of things, acupuncture can also treat that in a significant way. However, that requires a little bit of finesse. It's not just any needle that's going to do that, okay? Because we are trying to shift a chronic state. This is a state that people are in even when they're in what we call a parasympathetic state. It's a pervasive mindset. It's an underlying belief system. It's this underlying low-level condition that is feeding, right, the emotional state or the mental behavior. And so in order to treat that, we really have to do a detailed assessment and there's a lot of talk therapy involved in terms of not so much talking to them, but talking with them about like, okay, what's really going on one level. On the other level, acupuncture can release chronic emotional states if you know what you're doing. And so what we can do then is we can use acupuncture to start the process of allowing people to experience a state of being free from that particular emotion. And done consistently over a period of time, then that can actually affect their underlying mindset, their underlying behavior, and the processes that are actually generating those particular emotions, which is one great way of dealing with PTSD or dealing with depression, a biomedical, diagnosis of depression, or just, general melancholy and feeling frustrated and irritated by the world around you.
Absolutely. Absolutely. So thank you, Christian, for all this great, awesome information. Is there any upcoming events you have coming up, or where can people see you if they're seeking treatments and things?
Well, my wife Julie and I have a clinic in Dartmouth, Nova Scotia. Dartmouth and Halifax are sister cities. They're like right beside one another. So Halifax, right. Dartmouth, we're open 5 days a week, Monday through Friday, from 9:30 to 8:30 p.m. And if people are in the area, and they can just look us up on accessacupuncture.ca, book an appointment, and I'd be happy to see them. As far as events that are coming up, I have a pulse diagnosis class, which I'll be teaching probably in March. I have a fundamentals of balance method course that I'm teaching to local acupuncturists here coming up in February. And of course we have Chinese New Year coming up. So, we're looking forward to celebrating that.
Great. So for everybody, if you're interested in more information like this, Traditional Chinese Medicine Ontario supports the development and professional growth and practice of registered acupuncturists and registered traditional Chinese medicine practitioners in Ontario. So you can check out our website at tcmo.ca for more information. And if you're in Ontario, you can register as a member to get more development workshops or information like this on the back end, because we're going to be talking to Christian some more after this public piece. So have a great day, stay safe, and stay healthy. Till next time.